Well, this morning, a growing number of states are passing laws to protect doctors who refuse to perform certain medical treatments that go against their religious beliefs.
Yeah, this one's getting a lot of opinions. That can include abortion, gender-affirming care, medical marijuana, you name it. Supporters say this gives doctors freedom to stand by their beliefs, but opponents say it could deny patients life-saving care. NewsNation correspondent Stephanie Haynes joins us live from Dallas with more on this story. Hey, Steph.
Hey, Marky, good morning. These are called medical conscience laws, and it makes it tougher for a patient to be able to sue a doctor, a hospital conglomerate, or even their provider when they are denied specific care. And at least 17 states have either introduced laws or considered laws or expanded such laws, according to the nonprofit Guttmacher Institute. For instance, in Montana, a bill will go into effect on October 1st. That bill states that a medical practitioner cannot be assigned, requested, nor participate directly or indirectly in an abortion unless that practitioner consents in writing. Now, in Florida, a new law went into effect on July 1st, which protects doctors and insurers from liability if they deny a patient care based on their creed. This type of law has been on the books for years, but now supporters say these newer updated laws are expanding the rights for doctors, all the while critics say the efforts could be discriminatory, particularly when it comes to social issues like abortion and gender-affirming care. Here's how that conversation played out in Florida.
It's a very simple thing. The bill says that if I'm a physician and I have a conscience-based objection, I have a moral objection to something, I should be able to say no.
It's going to cause individuals to having to start shopping around to go find a doctor. And what if an individual is really, truly in need at that moment and they really need that care?
And Marky, another important thing to note here is that these state laws here in Montana and in Florida do not preempt federal law, which requires that doctors or health workers treat and stabilize a patient if they come to the emergency room and they need that care in an emergent situation. Marky.
Yeah, this one has been controversial, contentious. In a couple hours, we'll have a live interview with a former White House attorney and also a former Supreme Court clerk on this one. Stephanie Haynes, thanks so much from Dallas this morning.
Yeah, interested to hear that.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.